Hi, this is Jason. I'm one of the physical therapists here at Steppin Up Physical Therapy. If you're watching this video, you're probably struggling with some hip pain. One of the most common causes of hip pain is what we call trochanteric bursitis. Big fancy medical word for pain in this region. Commonly, you can't lie on that side and it hurts to walk, especially after you've been seated for a while. Those first few steps are painful. And so I want to go through a few things to help you work through that hip pain. But to give you an idea of what's happening, there's a bursa, which is a fluid-filled sac right here that's designed to help reduce friction as you walk. It's reducing friction from this band of tissue that runs from here all the way down, and as you walk, it's going back and forth across that bone. And that bursa is there to reduce the friction, but sometimes it can get inflamed. So today we're going to work on getting this area stretched out and to provide proper strengthening in the hip so that when you're walking, you're not aggravating this area due to a weak hip pushing out to the side. All right, so the first stretch you can use to help out with that hip pain that's on the outside of your hip, you're gonna need some sort of band, belt, sheet, something that doesn't stretch to help you with this. Here's the way it's gonna go. You can do this on your bed or on the floor, and you're going to put the belt around your foot and then lie back, straight knee. Bring this up until you feel a nice stretch in the back of the leg, and then you want to also let that fall somewhat over to the side. This is going to provide a stretch back through here, but also you're going to feel this here and right back in this area. Hold this for about 30 seconds, give yourself a break, and repeat a few times. All right, so the next stretch is designed for the front of your hip or your hip flexors. And if you can have a chair or a taller table, something to steady yourself, that would be helpful. And basically what you're going to do is take a step forward, and we are stretching this portion of the hip here. If I simply stretch or step forward and I'm doing this, I don't feel much of a stretch here. So there's a couple things you want to do. Let's keep your abdominals tight. Let's stay in tall posture. You're going to take a step forward. I'm leaning into it, and I feel it pulling from here all the way down to here. So make sure you're in good tall posture. Hold this, maybe 30 seconds. Switch sides, you want to do both sides, maybe 30 seconds, 2 to 3 times per side. All right, next we want to kick in some strengthening. So we've got 2 stretches, and now we want to strengthen this outside muscle. So you're going to lie on your side. You're going to have your top leg straight. And the important part of this is as I go to raise this leg during this strengthening exercise, I need to keep it in line with my body. I also need to keep my toes pointing forward. So as you do this, it should look like this, coming straight up, toes point forward. Don't allow your toes to come up and don't allow your leg to come forward like this. We want to kick in this muscle. So think lead with the heel, straight up and down. This is a hard exercise. If you can get in 10 to 15 of these, that would be helpful. All right, so again, this is Jason from Steppin Up Physical Therapy, and we just went through 3 exercises to get you started on helping out with that hip pain. Give these a try over the next week. Do these once or twice a day, and if you don't feel like it's getting better, it might be helpful to give a physical therapist a call.